ICSI is short for Intracytoplasmic Sperm Injection and is a technique used in the laboratory for certain couples. Those couples are usually couples with male factor infertility, so where the sperm parameters are suboptimal or perhaps where sperm has been surgically retrieved. We do occasionally use ICSI for other reasons, for example, when people have had failed fertilization previously or low fertilization rates in previous IVF treatments. Or sometimes, based on other factors, there's a suggestion to do ICSI.
IVF stands for in vitro fertilization. It is an overarching process of creating embryos in the lab, whereby we're mixing the gametes, the sperm, and the eggs. There's different ways where these gametes, these eggs and sperm can meet in the lab and fertilize. One of them is when we do conventional IVF, which is usually included in in the standard treatment. We are placing some sperm around the egg and leave the sperm to swim towards the egg overnight and then check fertilization the day after. ICSI, on the other hand, we are bringing both gametes even closer. We are injecting the sperm inside of the egg. And by doing that, we are bypassing some of the natural barriers that the egg has around it.
Couples are often concerned that there may be some risks associated with ICSI, and there was some early literature to suggest there may be a small increased risk of conditions such as cleft palate. However, there is no developmental abnormalities noted in children conceived with ICSI, and so overall it is perceived to be an extremely safe process that has been performed for a long time now.
When patients ask us is IVF or is it ICSI better, what is giving me the highest success rate in terms of fertilization? So it is a very complicated question to answer sometimes, but basically by bringing them both together, by doing the ICSI procedure, the fertilization rate tends to be higher with ICSI. So if we understand the process of correct fertilization as the target to measure success, then ICSI sometimes offers this.